Thank you very much, Business World, all the organizers and everybody here, and also Dr. Karan for joining online despite the personal constraints.
Thank you.
Um, for a very pertinent topic, which is building sustainable hospitals. Sustainability today is such a big global focus uh, across the world, across industries, in the wake of climate change and crisis that the world is facing. There are global mandates for large conglomerates and corporates such as Google, Amazon, Microsoft, and so on, to move to net zero energy ratings, to keep reducing their carbon footprint, so much so that even the vendors that they must deal with, even the office spaces that they rent when they move to countries such as India, have to be ESG compliant. And why must healthcare be left behind? Healthcare industry is one of the largest and fastest growing in the world. In India, 80% of the healthcare industry is hospitals. It is touted at about $132 billion by end of this fiscal year, if I'm not wrong. And for hospitals, hospitals are very large enterprises, 24 by 7 running enterprises. We use substantially more resources, more energy, and create much more waste than any other commercial building of a comparable size. Therefore, it is so pivotal for hospitals and healthcare industry today to take on the journey of sustainability, to become more and more environmentally conscious, and to work on reducing the large environmental footprint that we have. With this, I request Dr. Karan to set further context on the topic and also talk about some of the global trends in sustainability that healthcare industry across the world is seeing today. Over to you.
Right. Thank you. Thank you for that introduction. Thank you also to Business World, and my apologies that I am not there in person. But Manisha, as you said, you've laid the context very well. But I'd like to take a step back and look at the climate crisis is being contributed through human activity, and it's anthropogenic, and it's real. And it's important to underscore that because there are often debates that erupt about how much of it is natural and how much of it is being attributed by humans. But I think the science is very clear. Well, on top of that, you see the impact of the climate crisis is directly on human health, whether it is air pollution, water, biodiversity loss, migration, issues around the climate crisis are actually embedded in health. So the climate crisis is a health crisis, and I think we should start addressing it, like whether it is dengue in the winters or a changing pattern of malaria, which is being seen in places up till now that was not being seen. Similarly, air pollution is causing respiratory distress, and today there isn't a city in India and very much part of the world, any part of the world where you will not find air pollution leading to being a direct cause of human distress, especially on respiratory illnesses. Now, at the same time, it's important to understand that while the climate crisis is the health system itself is also contributing to the climate crisis. Last year's the Lancet Countdown report on climate change and human health actually put the number that the health sector contributes to global emissions to be close to about 5%, just over 5.1%. If you compare that with any other sector, for example, shipping contributes to about 7 to 8% of all global emissions. So the healthcare sector is a large emitter. If it were to be a country, a standalone country, it would be the fifth largest emitter in the world. So currently we are emitting about 2.7 gigatons of carbon dioxide equivalent into the atmosphere annually. And therefore the need for the health sector also to come and step forward and really look at ways by which it can reduce its own carbon footprint, and also look at ways of substituting the current practices, the current use of materials, and also our entire way of operating in the built environment to ensure that this footprint reduces in the years and decades ahead.
Right. Thank you, Dr. Karan. And just to add to that, aside from the benefit of being more judicious and transparent in using Earth's resources, there is also an advantage of ensuring long-term viability and a lot of financial benefits that are also there of building sustainable hospitals. We know that there are a lot of global funds, multilateral funds, even sovereign funds that are now, that have a mandate to only invest in companies, including healthcare companies that are ESG compliant, that have sustainable practices. There is also green credits that are a very common structure outside India that are very commonly traded, and that's a huge financial incentive to adopt sustainable practices. In the budget of this year, 2023 annual budget, it has been proposed to be launched in India as well, a green credit program to similarly incentivize corporations in India. So that's a big benefit as well. Now moving on to some of the practices that hospitals can do, are doing in this lieu. And just to start with my personal experience, when I started one of my previous greenfield hospitals, it was a multi-speciality hospital, but the good thing is that we did a greenfield and we were able to sow the seeds right at the start. So right from the design phase, we were able to instill a lot of sustainable measures from the time we just like buying of raw materials. So we got sustainable raw materials which were either recycled or reclaimed. We were able to put energy efficient lighting, HVACs, chillers, VFDs on high running equipment. We were able to also optimize on building orientation to get more natural lighting, to get ventilation, and also newer but a very now increasingly becoming common thing is of integrating advanced workflow optimization. So right at the time of design of the hospital, putting an optimized workflow in the design, in the blueprint of the hospital. By an optimized workflow, I mean both in the patient-centric, in the frontline areas, as well as for back-end processes, looking at synergies of all the processes, how the loops are closed, so that there is efficient use of resources, there is improved employee productivity, there is less use of energy, and of course there's saving on turnaround time and operational efficiency, which in turn saves cost for the enterprise. There is also simulation tools that are available. I remember we used a simulation tool to be able to make a operational workflow that leveraged the tool, and then we could implement it in the design when we firmed it up. And we also used energy management system. There are a lot of tech-enabled tech platforms that help project managers to better use energy management during the construction phase and right after it. So all in all, so many initiatives, and there's a lot more. I've touched on the high points that can be taken, and which hospitals are taking, large hospitals like us, in building green fields, so that we are able to put it in the DNA of the hospital right at the start, and from there on it's an easier journey. And turning to you, Dr. Karan, would be great if you share some of the sustainable practices that Apollo Group has taken for its running hospitals, and some of the ones that you're looking at to implement in the near future.
Right. So we have an ambitious agenda as part of our Apollo Sustainability Action Program, ASAP, and we've put our commitments out there. Currently, we're using about 19% of all our energy sourced through renewables, and we've committed to upping that to 25% for across our value chain, which includes the pharmacy division, the hospitals, and the clinics by 2025. Further, we've committed to upping this to 30% by 2030. So 30% of all sourcing for energy, which includes purchased electricity, which is part of our scope 2, and also energy that we may be sourcing in terms of fuels, is going to be from renewable sources. As a transition we have moved away from high carbon fossil fuels and have transitioned into LPGs, and now we're going to be moving to the renewables or even low carbon versions as we transition. That's on the energy side, and there are complications around how much you can actually source, given that there are regulatory constraints around that. But within you spoke about, we've implemented a lot of low embodied carbon materials, both for our new builds and also for our retrofits. But a lot of it also is built into the like you spoke about, VFDs, the HVAC system, cooling tower efficiencies, etc. But a lot of it is also to do with practices at the patient facing end. For example, we did a study and we found that if we increase the ambient temperature from 20 degrees to 24 degrees, which does not really impact hospital infection or patient comfort, we could actually accrue savings up to 24% in our energy consumption and use in many cases. Now, obviously, where there is sensitive equipment or there's a patient, you'd have to sort of temper that. But the point being that with building management systems now in vogue, we can actually make these small tweaks and accrue very large, benefits. Similarly, for our dialysis department, we know that each dialysis takes anywhere between 150 liters to 200 to 250 liters of water. We are actually using the discharged water back into various non-clinical processes so that it can be recharged and reused. Similarly, we've got targets on waste reduction and water consumption. Currently, our big hospitals, 18 of our big hospitals, are reusing about 25% of the water into various functions like HVAC, cooling towers, etc. We are wanting to up that to 50% over the next 3 years, and we have a plan in place for that. But similarly, for waste, again, it turns out to be a slightly tricky issue. But as you, in your opening remarks, you said we are a large generator of biomedical waste. India creates about 56,000 tons of waste that very little can be done with, and we are looking at a 10% year-on-year reduction from our 2019 to 2020 baseline, and accrue that by 2030 to have a significant reduction in our biomedical waste practices, and also how we're going to be using that when it is going to a landfill. And we are hopeful that there could be newer technologies that come along the way where we can actually treat some of that waste that is generated, hazardous waste, on site before moving it to the landfill or for incineration.
Thank you. Very valuable insights, and great to know everything that Apollo is doing. Just to add a couple of points to this, I think as hospitals, it is also our responsibility to instill a culture and inform, educate, and inspire everyone to follow the principles of reusing, reducing, recycling. And to that effect, some very hygiene basic things, but which go a long way in setting the right culture that we can do is, restricting the use of disposables, whether it is in medical areas and consumables, accessories, and using reusable items as much as possible, minimizing toxic chemicals in cleaning, even in operating theaters, and substituting with more organic products. Putting sustainable food practices. The hospitals are very large kitchens. We, make food probably for 500 plus people 3 meals a day. And so, having a concept of farm to table, procuring organically grown, sustainably grown local produce from local farmers. It also supports local economy, but is sustainable, is beneficial for patients, managing the demand and supply to reduce pilferage, having tie-ups with local shelter homes and charities so that the excess produce not wasted down the drain but can be donated. So small actions like that go a long way in creating the right culture and right impression and sending the right message to everyone on the front lines that work in the hospital. coming back to implementation, you listed so many best practices that Apollo is doing. I'm sure a lot of large hospital groups are also looking at adopting many of these. What are your thoughts on driving governance around ESG, around sustainability? How can large hospitals like ours have rigorous governance around sustainability and make sure there's implementation cascades across the network?
Yeah. To your previous point, I think you've raised a very important issue and set of issues. One is that we have the benefit of the Indian mindset is towards saving and conscious consumption, and I think that needs to be tapped onto in our operating milieu, even when we are looking at sustainability. And there are quick wins, as you said, and then there are strategic moves. For example, we know that reducing the consumption of meat will have a big impact on methane production, which is a very toxic GHG that is emitted every year. And again, we find that although not all of India is vegetarian, but there are pockets where it is encouraged. And I think that is something that can be, we can move the needle on, which will have direct benefits on human health and also on animal and planetary health. Coming to your point on governance, any good sustainability program or a program around ESG disclosures needs to be rooted in very good governance. For example, at Apollo, we have a board level committee which is looking at sustainability. I report to them, on the aspects of sustainability where we have acted upon, and also seek their guidance. So the CSR committee, which was previously mandated with aspects of our corporate social responsibility, now doubles up as the CSR and sustainability committee. Now, what that does is it really drives action from the top of the organization to folks like myself to really drive this on the ground with leadership across our three business verticals. We've also put in a very strong sustainability council, which has representation from all our businesses and ensures that what the board wants is actually created into bite-sized programs and are then implemented on the ground. For our hospitals divisions, for the large 18 hospitals, we have green teams. And these are multi-dimensional teams which have representation from clinical nursing, quality departments, and operations folks, along with supply chain and HR, to really drive some of the goals that we've set out for ourselves. So those are some of the aspects around governance which are important, but structurally it's very important to have a cadence which works from the board to the patient-facing areas and backwards. And we've seen that whenever an organization has identified a sustainability lead or has had a formal governance structure, the success rate of sustainability programs can go upwards to by 75% to 80%, and there is research on this. So first and foremost, I think along with measuring and building good operating systems which can measure the impact that we have, it's going to be critical to build in governance so that there is a cadence and there is a structurality to sustainable practices. Because yes, hospitals do a lot; they might do in bits and pieces. The importance of tying this together and having good governance cannot be underscored more.
Well said, Dr. Karan. Echo your thoughts. And just to close, I think our time's up, but governance for sustainability in hospitals will really, as you said as well, has to be driven from the top, right at the board level, but drilled down and imbibed by all the employees. And it is important to set processes, set norms, mandates, but also walk the talk, whether it is use of electric vehicles to do inter-hospital transport, observing Earth Hour, sustainability hour every once in a way by dimming lights and minimizing usage of resources, reducing usage of paper, inculcating, reusing, reducing, and recycling as motto and mantra across all employees. That will go a long way in creating sustainability as one of the pillars of running hospitals, setting up hospitals, and really instilling it in the DNA of future hospitals. Thank you, Dr. Karan. Thank you,
Thank you.
organizers. I'll close here. We are available for anything.